Hi, it's Chelsea with Wound Care University, and today I'm going to talk with you guys about something kind of cool I worked on. This is proactive pressure injury for patients undergoing hyperbaric oxygen therapy. When you think about it, these folks are often immobile for extended periods of time, but you don't really hear about pressure injury prevention in terms of hyperbaric. So this population is very frequently overlooked. These patients come to us generally by stretcher. They get transferred onto the hyperbaric stretcher. Then they stay there unable to reposition for sometimes more than 2 hours at a time between vitals, the actual treatment, post checks, wound care, the whole thing. So this project that I worked on focuses on a very simple, replicable practice innovation that is designed to reduce pressure injury risks and improve healing outcomes for hyperbaric patients across multiple facilities. This first occurred to me as an issue when I began lecturing in our Intro to Hyperbaric Medicine course. When we were discussing patient comfort prior to compression, a lot of it was making sure that they could clear their ears correctly, sending them in with a urinal, making sure they have water before they go in. But I started to think about this more in terms of offloading not as a comfort measure, and just kind of seeing later what the big picture implications of that were and the impact that this could have. Hyperbaric patients are uniquely vulnerable to pressure injuries. Once these folks are inside the chamber, most of them could not reposition independently, even if they did have a rail in there to grab onto, which is going to lead to sustained pressure on their heels and sacrum. So, despite the fact we're throwing a lot of advanced wound therapies at these folks, a lack of standardized pretreatment offloading practices will definitely end up worsening our patient's overall condition. And if you are kind of experienced in the OR, you hear a lot about those patients. Well, if the surgery is going to last more than 2 hours, we have to make sure we're doing some kind of offloading, some kind of floating heel. Our patients are on this stretcher for quite a bit longer than 2 hours, sometimes depending on all what's going on. And the surfaces of the hyperbaric mattress are not optimal for pressure redistribution. So my work began with a very simple realization. Once our patients are inside the chamber, our opportunity to prevent pressure-related harm is over. So risk to their heels, their sacrum, periwound tissue, all that is established before the treatment begins. With pressure injury prevention, we are educating our patients about support surfaces. That's one of the big things we preach in wound care. We talk about using pressure redistributing surfaces for high-risk patients. The egg crate thing, appropriate mattresses, overlays. That's an obstacle in the hyperbaric environment. Because of safety issues, I can't change the chamber bed surface. So pre-treatment positioning really makes itself obviously very important. So we are focusing on moving prevention upstream by standardizing offloading and positioning at the point of entry. So we are protecting vulnerable tissue, improving patient comfort, and supporting the healing intent of hyperbaric therapy, not working against it. The emphasis on this project was consistency over complexity. So I wanted to create an approach that is low cost, very easy to teach, and scalable across facilities. This intervention was implemented across 9 hyperbaric facilities to ensure the workflow was practical in real-world settings, not just in theory. We introduced a standardized policy requiring a pre-treatment skin assessment that is not quick. It's a fast little pre-skin assessment, checking their documented Braden scale, doing some heel floating, and if needed, sacral offloading to protect any peri-wound area tissues there before chamber entry. Additional pressure points, of course, are addressed as needed based on the individual patient and what kind of risk they might have. If it's an elbow, there's certain contractures involved. Staff education focused on why these steps mattered, not just how to perform them. And compliance is reinforced through simple audits and observation. Now, importantly, the workflow was designed to fit seamlessly into our already intense already existing pre-treatment process that we do on a more like safety aspect of things before hyperbaric treatments without adding any time, cost, or operational burdens to our very busy clinics. After implementation, we observed that there is a meaningful reduction in patients reporting of complaints of pain after treatments. We have a program where we track any adverse reactions and why patients are shortening their treatments. Any termination treatments need to be documented. And one of the big reasons why was pain. So we noticed more patients who are completing their entire treatments as prescribed without needing to exit the chamber because my heel hurt, my sacrum hurt. Equally important though, staff awareness and accountability around pressure prevention significantly improves when it's in the forefront of our mind when we're actively talking and educating about it. What's great here is that this work demonstrates that pressure injury prevention does not require super complex technology. A simple workflow like this can dramatically improve patient comfort, help prevent very avoidable harm, and reduce downstream costs. In our case, we're able to use Hyperbaric safe pillows, wedges, blankets, whatever we have available. So this intervention is really easily replicable and supports pressure injury prevention as a core component of the Hyperbaric standard of care. Really, the most important outcome of this work is not a single metric, but there's a shift here in culture. Pressure injury prevention has to move from being reactive to proactive, and from being the responsibility of the wound specialists, who are a very big part of our team, to a shared responsibility across our care teams. Our hyperbaric techs and nurses are very educated in hyperbaric medicine, hyperbaric safety, but when we talk about pressure, they're usually thinking about depth type pressure, not this type of pressure. So if we are educating, if we're normalizing offloading and positioning as a standard practice, not as an added task or a burden, we're going to increase awareness and reduce any preventable harm. So looking forward, I hope that this work supports embedding prevention into everyday workflows for education and documentation props in many different facilities. Ultimately, sustainable prevention requires awareness, consistency, and a system-level commitment to protecting our vulnerable patients before these injuries occur. Thank you for your time. Just remember, when prevention starts before the chamber, we can create safer, more effective care for our patients.